Welcome back to another series. We're back with Dr. Milton Dowty, our researcher and developer of this CPK association biosystems integration technique. We gave you a little talk about the gravitational defects, basically, or the gravitational positions of the body, and I want to go into that a little bit today. So talk to me a little bit about one, even just like, did you start with that right away? And how did you find the different positions produce different things?
Yeah, there was always some kind of talk about, well, you need to test people standing because maybe they got a leg discrepancy or a prolapse in the foot or ankle. And yeah, those are pretty common concerns when you're just looking at it with a chiropractic assessment. But I thought of a story.
Yeah.
One of my first ones. I was new in practice, and I was using kinesiology-based technology. And so I had a new patient, and I heard a car door, and I looked out the window, and I saw a car pull in the parking place, and then I waited and waited, and nobody came to the front door. And so I went to the window, and I looked out, and much to my horror, here's this 200 and some pound man crawling on his hands and knees up to the front door of my office. And I'm going, oh my. So my skills were really put to the test.
Absolutely.
But here's the phenomenon. He was an electrician. And you know that when I examined him, there was very little to observe physiologically to contribute to the amount of low back pain that he had.
Mm-hmm.
And so
what posture was he in when you examined him?
Well, on the table.
Yeah, laying flat.
Yeah, laying out on the table.
Yeah.
Yeah, that's, that was the quote go-to thing to do.
Absolutely.
So finally it entered my head, so what was it you were doing when you got into this dilemma? And he says, well, I was crawling along the baseboards putting in outlets. I'm going, on the floor. He got on the hands and knees, and oh my, his low back lit up like a neon sign.
Yeah.
And that was a big, and here's what I mentioned before, it's all about observation and seeing with eyes that see and listening with ears that hear, to pay attention to the intricacies of your relationship with the patient. And so here he is, hands and knees, and he's lit up. I worked on him while he was on the floor.
Yeah.
In a hands and knee position. And over time, and some testing and experimenting and all, we found that basically there's 7 basic postures. We call them postures or gravitational effects. There is, of course, we're sitting, our cameraman standing. We have supine and prone, left side down, right side down. These are sleeping postures.
Yeah.
And people that can't sleep, you put them in the posture that disturbs them, you will find an amazing amount of disturbances that you won't find in other postures.
Yeah, absolutely.
There are 2 other postures that I don't often speak of. One of them was what I just mentioned about the gentleman on hands and knees. We call it the hands and knee posture. And we usually hang their toes off the end of the table. We don't get on the floor anymore.
Yeah.
Hands and knees on the table, and then examine, and it will reveal some remarkable things. And there's one more that we call the fetal position, which they tuck their buttocks or pelvis down to their heels, and they drop their head down on the table. An amazing amount of things will show up in that position.
Yeah.
So, yeah, it wasn't a, well, let's try all these things. It's just over time, a little bit of experience, and when you hit a dead zone and you can't find the next step in the process of healing, you get desperate and you try things, and with the system, it will reveal that, yeah, you're on the right track. Just keep going in that way.
Yes, absolutely. Yeah.
So, yeah, that happened several times over the years. And keep in mind that I have 50 years in practice.
Yes. Yes, you
do. I've had a few opportunities.
Again, he, like we said, kind of in the first video, is just you're constantly curious, constantly like checking and seeing what you've got going on. And so, in a typical visit in a day, you're always going to check different postures and putting the patients in different postures, see what comes up.
Yeah.
Right.
One of the phenomenons that I didn't expect is that our system actually will dictate what position of the body the correction should be performed in. And I think all chiropractors have kind of glossed over this. We know that some chiropractors prefer to adjust your neck sitting up.
Yeah.
Some of them while you're prone, some of them while you're on your back.
Yeah.
Some of them are side posture.
Absolutely.
Where'd these guys get this idea to do that? But they just stop right there. They haven't considered just to fix a hip. It might need to be while they're left side down, or while they're supine, or while they're prone, or while they're on their hands and knees. See, and any other joint or any other portion of the body may need a specific position. But the system that we discovered and promoted is it always puts the patient in a position so that the adjustment is always straight down. Facilitating gravity is what I call it.
Yeah.
And so it kind of simplifies how you're going to do it. You're going to do it straight down. So you just put them in the correct posture, and it will reveal exactly how that tissue is going to be corrected.
Absolutely. I know from my experience in practice, I'll get to a certain point, and this is always from you, check their posture. If you're not finding anything else, check their posture. Yeah. And most of the time, if you change their posture, it's going to reveal something else and something different.
That just reminded me of something else. The field of kinesiology, or particularly applied kinesiology, there is some discussion all the time about being switched.
Yes, yeah.
Neurological confusion is another way to describe that. And the discovery was, here again, paying attention to details, is that a person that is switched is actually being tested in the wrong posture. Mm-hmm. So neurologically, they are operating in another posture than what you have the patient demonstrating on the table.
Yeah.
And so it's not about correcting neurological confusion. It's about changing the body posture to match what the neurological signal is.
Wow, that's amazing.
And that's so it's just kind of like a flip side of the story. And do we give any idea of how some of that is done?
Yeah.
I'll try to be quick about it, but a lot of my work with acupuncture for 3 years of training was in the study of holographs and polarities, and the polarity of the hand, which we'll talk about some other time. All the electrical potential that's in the hand is totally amazing. But if we use the palm of the hand, not the fingers, but just the palm, and we touch over the left ear, and you get a weakness, you know then that they should be in the left side down, and then the right side down, and the prone, and at the EOP, or the protuberance at the back of the skull, that would be supine. And if you slide down to the base of the like C1, C2 of the occiput, that would be for sitting posture. And then this would be for inversion, or upside down. And you go, really, upside down? Well, yeah, that means that you're going to approach it from the bottom up.
Yeah. So for patients watching this, or students or practitioners, just that idea that being able, this is why we're doing these things. We're checking to see what postures to go to. Absolutely. Yeah. I know some patients are very curious and ask me like, well, what are you doing now? What are you doing now? I'm like, I'm just checking your posture, but here's the background. Here's the reason why, again, because that neurologic integrity will change if gravity puts pressure on it in a different way, which is the posture.
It's the mechanoreceptors at work.
Yeah.
And we kind of talk about them, but we don't trust them to follow them.
Yeah.
Yeah. So we want to make it convenient for us instead of convenient for the body to correct it.
Absolutely. All right. Well, in future videos, we will be talking a little bit more about that hand polarity. I know we have been discussing it a little bit about what we want to talk about. But thank you for paying attention today and joining us.